So, what are the noted disparities that are seen in DLBCL? Sometimes we talk about clinical trials. Some people don't have access to those clinical trials. What are other disparities, and how can patients overcome those to get the best outcome?
Yeah, absolutely. So I think that America is an incredibly large and diverse country. I think we know that by just watching the news with people of all walks and colors and different sort of opinions on how they view their world. And so I think, one simple bias is I am a lymphoma specialist at an academic center. However, I live in a larger city, in the city of Milwaukee, and covering a geographic area, even of the size of the state of Wisconsin, not everybody has access to this center. Some of my patients have to drive 3, 4, or 5 hours away to get complex treatments that aren't even available in the community, or even, have the opportunity for clinical trials, which are most often centered in larger academic centers. So I think that just simple geography is an issue that creates accessibility and sort of impacts the type of care that a patient is able to get. I think beyond that, there are obviously, economic factors, right, that, drive a patient's ability to, get specialized treatment. Do they have money to afford the gas to get to a larger center? Do they have the resources or the support system available to get a complex therapy where you would need those treatments, especially for relapse disease? And then I think there's always going to be, racial factors and accessibility, issues that happen where patients aren't referred, in time, or patients aren't getting necessarily the best care that they can. So, I know that in the world of diffuse large B-cell lymphoma, we have lots of great treatments, which is the exciting part for me. My biggest concern remains that not all those treatments are accessible to all the patients that they need them. And I think we all need to do a better job of educating our community, of making people aware that these options are available, and then also facilitating patients who have less money, patients who have less resources, to be able to provide them what they need to be able to get the treatments that are best for them.